All right. Good morning, everybody. We are live on the Harlem Emergency Network COVID-19 update. I'm Bob Ponce of Harlem Emergency Network. I'm pleased to have a guest this morning, Mualimm-Ak, who is not only president of the Incarcerated Nation Network, but also a primary participant in the newly formed South Bronx Emergency Network. How are you doing this morning?
Good, good. Sad to say, in New York, we're still facing this pandemic on a leaving end. So the impact is a little bit less than what we've had in the last few weeks, but it's still a hard hitting pandemic. And we're doing community feedings and starting to do PPE on a regular to deliver to people in the community. So it's definitely a busy time.
Absolutely.
Yes,
So
sir.
I want to start off as we usually do. We like to take a look at the numbers just to show people exactly where we are based on the city data that's available. Okay, trying to share the screen and we're having a little technical difficulty here. Let's see. Okay, let's try it again. Okay, here we go. So yes, let's look at some of these numbers specifically. We always like to make sure that we really look at the data that's actually available and not go with just what we hear in the mainstream media. And even then, we make sure that we challenge the data. So as we can see, we're still looking at confirmed deaths in New York City have been 16,059, plus another probable deaths of 4,828. So that's about 20,000 people who we know or suspect have died as a result of COVID-19. That's a horrible number, obviously. The good news is that the numbers have been going down, and
Right.
so as we can see with these charts, this is information on cases, and as we can see, the peak, which was around April 6th, we are down here to levels that are basically around where we were in early March. We can also look at the hospitalization numbers, and we can see the same drop down that we've gone from a peak, where we were seeing, almost 1,700 people a day going in the hospital in early April, and now we're down to, under 100 a day. And the most important number, obviously, is how many people have died, and we also saw that similar peak on April 7th, and we're going to a point where we're really down to levels that were, basically pre-COVID, or at least pre us seeing, the impact of COVID. So
Right.
that's good news. At the same point in time, we're still in a situation where we are concerned with reoccurrences.
Right.
So one of the things we wanted you to come on and talk to us about, and let me see, I'm trying to see if we can bring Carol Johnson on the stream of Harlem Emergency Network. Hey, Carol, are you there? Carol, can you hear us? Can we hear you? Okay, Carol, we can't hear you yet. We're going to no, we're going to come back to you. It still seems like we're not getting the sound that we need to get. So I'm going to go back to 5, and we're going to
Yep.
try to come back to you later on
So,
in the stream.
so let me just give a snapshot of what we have in New York State. I'd like to
Mm-hmm.
start with just understanding what the state is, right? And
Mm-hmm.
so New York State was one of the first states to invent prisons. Let's just remember that.
Mm-hmm.
When we had Ellis Island, we also built Rikers Island, right? And they were building
Mm-hmm.
at the same time, both indoctrinating people into our way of society. And so
Mm-hmm.
New York State has 62 counties. Out
Mm-hmm.
of those counties, we have 52 facilities. And those facilities are named after the counties are named after the jails. And so
Mm-hmm.
Attica Prison was there. And then, of course, the town of Attica came up out of the prison being there and people living and buying new homes and creating an environment to work in those prisons. So we have we have over 50 prison towns. We have 79 county facilities in the state. That is a lot, right? County jails. We have solitary jails outside of all of those jails. Then we have federal jails. Then we have detention centers. Then we have private prisons. So that's a lot of land and dedication to caging mostly Black and brown bodies, because New York State has one of the highest ratio disproportionate amount of people in the prison. So we're talking about majority poor people of color. And so that's just the landscape. Now, the numbers that you were reading are all state and city accounted numbers for deaths. What we don't hear is the people who are counted in prison are counted separately.
Oh, interesting.
Right.
So
they're not.
Do we have any idea about death numbers in the prison?
Yes, we've had over. Right now, we're looking at over 20 deaths in New York State, but those are confirmed. We have hundreds of officers who are out. We have hundreds and thousands of people who are in the hospitals in all of these prisons. The reason why I'm saying these numbers is because 80% of most of the facilities are already affected, like the entire facility. These are also the people who are burying the other people who are dying, right? Because those who work in Wards Island are sentenced from Rikers to do that. So that's how we're getting this information rate of how they're burying bodies, and the bodies that they are accumulating in jail aren't being mentioned. We don't hear the governor speaking about these people as if when people are incarcerated, they just disappear. And on the front line, there were never any concern for the people that they had already accountable in their cells. They knew where they were at. They knew what locations they were at. It was easier to treat these people. And so as we see the deaths happening, the governor's solution is to place everyone who was infected or impacted with COVID-19 into solitary confinement. And that has led to disastrous states. And so, we're talking about the majority of Black communities, because 1 in every 3 Black youth or Black man is either incarcerated or have experienced that in his life. And that impact is mostly because of certain systems that we have that activists were saying and organizers were saying, you can let the people go that you already approved for parole. You could release people who are like over 80, like they're non-threatening, the least to reoffend. None of these wishes were amended. There were 8 pregnant women who we just got released a few weeks ago because a woman had died from COVID-19 while giving birth in her cell. And so we ignore these people, and I think it's a time to use how we have this commonality, right? People are quarantining themselves. They're starting to feel what it's like to be trapped in space for a long period of time. And I think that now is a time for people to sort of look at this quarantine and imagine on an extreme level where your literal physical body is detained and you don't have all these amenities that you have at home, right? You don't have the ability to get life-saving equipment, or you don't have the ability to socialize because you sell with 6. And we don't often look at those who are incarcerated family members because they incur another bill. It becomes a dependency to support them. These are lives, and I believe that we're not going to hear from the.
Okay.
And at the same time, everybody know that New York State is very unique. So we were in these stages of reform the bail system, right? In New York, we have $200,000 per pay on Rikers Island, and incarcerate so many people Rikers Island because of the dangerous notion that if you're enforcing social distance, which of course we've seen in the media, these two components play hand in hand, because once you're arrested, you're then transferred to the jail facility. And a lot of times we don't look at that connection. That connection happens from NYPD, the world's country and the nation's largest military police force. We've seen them handing out masks and gloves downtown in Central Park and being very nice and not enforcing social district in the upper class or upper income neighborhoods. But when it comes to the Bronx and the communities that are hit the hardest and directly impacted, we've had a ramp up in arrests. Why is that? Well, the bail bill, the governor rolled back. And so people who are being arrested for misdemeanors aren't going to be allowed to have bail. And you could be locked up for trespassing, and now you're going to go into the system. And so in the initial stages of this pandemic, we were saying we have people with respiratory illness, we have people with tuberculosis and all kind of other vulnerable conditions that they should be released or given clemency. And the governor responded by forcefully releasing those people and then rolling back the bill to increase the arrest rates. And so how frivolous was that? He released 100 people, and then by that night, Rikers took in 120 people.
Wow. So the net result was 20 more people in than we started, which is not the best way to reduce population for social distancing.
I mean, that was just that one day. So after that, everyone who's arrested is now denied bail. So we're only increasing the amount of people back into Rikers. So it's a constant battle. Right now, the city jails are trying to change the laws in which they can isolate people who are impacted by COVID and using a disciplinary measure, which the United Nations has declared torture. Solitary confinement, holding a person over 15 days is considered torture. They're using that measure as a safety measure, but they know that having these variance hearings, they understand that having these community hearings where nobody's going to know about it, nobody's going to show up to, they can make these changes to continue to confine people. And it's mostly poor people of color, mostly our youth. And so we're looking at a daily arrest of 90 to 150 people in New York City every day. That is our latest numbers on a regular basis. And these are only coming from these small communities, basically 5 neighborhoods, you know?
So how can people make their voices heard? How can people support your efforts to bring attention to this?
Well, one, Incarcerated Nation Network is our website. There's all kind of different resources. You can link to the different organizations getting involved. 2, you can call your legislator. Because they're mostly confined, these are legislators who are being paid right now. They're still on salary as essential workers. So there's a little increased access to them and their staff and letting them know that you have a family member incarcerated. Sometimes we forget to advocate for our own family. I remember a time when someone was coming home from prison. It became a major thing in the neighborhood. Like, you know, the reverend is speaking about it that Sunday. Like, they're collecting a little something for that person coming home. But you know, America has normalized incarceration to the point that it's a process, right? It just feels like normal. And so we don't reach out to our legislators. We don't speak on behalf of our family members who are incarcerated. And that's a very powerful notion, because that legislator can go into any city jail at any time he wants. That legislator can go see your child and make sure that he's okay if he has issues. So holding them accountable to the duties that they are as representatives is the number one thing, right? That helps us keep the judicial process, that helps us keep due process as a fair system. The second thing is, of course, donating to SBEN. We have a South Bronx Emergency Network fundraiser right now on GoFundMe. These donations are getting family members who are having incarcerated members the equipment they need, because we know if you have a husband or a son who's locked up and you're on food stamps and you're getting $215 on your budget, $50 or $60 you're going to spend to send that person a package. You're going to have to continue to care for that family member, even though they're in a different county. The second thing is, honestly, and I know that a lot of people have conspiracy theories because they don't understand gerrymandering and how the prisons do sort of use your citizenship in other counties. It's really
Mm-hmm.
the census forms. And so filling out the census forms is a duty
Mm-hmm.
that we tend to ignore. But this is
Mm-hmm.
also how we can hold the state accountable for your family member incarcerated. If
Mm-hmm.
that family member is in Wyoming County or in another county, that county is getting those funds. Unless you say,
Mm-hmm.
that's my son who resides here, it doesn't
Mm-hmm.
give advocates and legislators a chance to separate those address lines and where the funding should go to. And
Mm-hmm.
so when we lose a person to prison, we're losing community funding as
Mm-hmm.
well. You
Mm-hmm.
know, so $70 to $100,000 are leaving per person. And
Mm-hmm.
just imagine that. That's probably like $1 million in your head right now of people in
Mm-hmm.
one square block who are incarcerated. And
Mm-hmm.
so it's really about the money. And I think that when we follow the money,
Mm-hmm.
when we as community demand that our community gets those funds, our
Mm-hmm.
community gets the resources we need, we can change the dynamic of dependency. And so I say, being involved with the local groups in the districts as we're doing, as we're bringing these emergency networks to expansion, is vital to be counted
Mm-hmm.
on. You know, yes, sir.
Mm-hmm. Great. So I'm going to see if we can bring Carol Johnson back into the conversation.
Yes.
So bear with me. Carol, good morning. How are you?
Hallelujah.
Okay, Carol, we see you, but we don't hear you. So, Carol, we're going to keep you up on the screen, and we're going to see if your audio comes in. We're going to keep the broadcast going. Um, and Carol, I want to talk a little bit also about what they are now calling pediatric multisystem inflammatory syndrome. I
Yep.
love that there's somebody somewhere whose job is to just come up with fancy names for things.
Right.
Um, this is the disease that we're now seeing amongst young kids that is not the respiratory disease that we're seeing out of COVID-19, but it's basically a rash of other symptoms. And what we're now finding out is that there is a high percentage of boys who are suffering from this. So this is another thing that we have to be concerned about in terms of looking at not only the fact that people were led to believe by media information that kids were not being affected by COVID-19, and what we're seeing is that while they're not having the respiratory effects that people in older demographics and people with comorbidities are having, but there is something that's going on that we need to be concerned with, and we want to make sure that parents are aware of this because we've seen parents out there who are not protecting their kids with PPE, and thank God that they did make the choice to shut the school system down, to the end of the year, and let's push it off till September until we find out what's going on, because we would probably be seeing a much higher incidence of this. Let me see if I can say it:
Definitely.
pediatric multi-syndrome inflammatory syndrome. Say that 3 times fast. And it's something that they say is something like Kawasaki inflammatory
Absolutely.
disease. They've described it as that. I'm not sure if it's that exactly. Usually, when they come up with a new term like that, it means we don't know what it is, so let's come up with a new name and pretend that we did.
Right.
Um,
Right. I
so it
think that this gives us a moment, Bob. It gives us a moment to really look at the social determinants of health within the
Mhm,
Black community, right? We have been neglected, of
mhm,
course, for over
mhm,
400 years, but there is a labeling and a
mhm.
stigmatic higher incidence of respiratory illness within the Bronx, especially within District 3.
Yes,
We have the highest rate of
absolutely.
youth, and especially Black kids with asthma. We have the
Hmm.
highest rate of youth with mental health and other conditions that stem from systematic health conditions. And so,
Mm-hmm.
yes, sudden acute respiratory disorder, SARS, is really impacting a lot of adults and the aging, but we see something different happening with the youth. I think,
Mm-hmm.
to me, number one, it's governmental neglect to withhold information, because that's also a form of genocide, right? To be able to
Mm-hmm.
say, we just got to tell you to protect yourself, or we could provide protection only for the
Mm-hmm.
rich and the wealthy.
Mm-hmm.
It's an attack on our youth, because that's who's really going to be impacted.
Mm-hmm.
In
Mm-hmm.
New York District 15, which is one of the poorest districts of the nation, right, in the South Bronx, uh, we've got the highest rate of sexually transmitted disease and the lowest rate of healthcare insurance members in some sense. So in our districts, maybe half of people in our districts have healthcare. Everybody even has
Mm-hmm.
food stamps, don't even have healthcare. And so I think that those numbers are
Mm-hmm.
starkly different in our poor Black community.
Right. There's a common thread that we've seen throughout this crisis, and that is the thread of us being under-resourced in the responses.
Yeah.
Um, I'll speak for Carol, who's here in visual presence, and we've talked a lot about this, about the fact that she's in East Harlem, and East Harlem has been banging the drum just to get testing sites, even though they had one of the highest incidents of COVID-19 in the city, and it's been well known well into this process. We've been following the zip code maps, and her zip code consistently registers as one of the highest. It's well known, and yet why does it take so long for the city to marshal resources at the places where it's most needed? And that is not only obviously East Harlem, it's certainly all over the Bronx, where it's had multiple zip codes with high incidence. And why are we seeing stations being set up in Central Park, which is that area has literally been amongst the lowest in the city of COVID-19 incidents.
Right.
And so
Yeah.
let's take care of them first. And we have to continue to bring attention to these things, because I give Governor Cuomo credit for the things that he's done right, but he has not by any means had any kind of perfect track record in terms of the state
No.
response on this. And so I give him credit for heeding the call and mobilizing things just before things could have gotten way worse. I think we have to obviously understand that there is a failure in the medical system in general, not just from the government, but from private and public institutions here in New York, at not being prepared for this, when there was of
Yes.
of uh, plenty of information in advance that we had an impending danger of a pandemic such as this. There was literally a pandemic exercise in October 2019 right here in the city, where they talked about everything, and everything we suffered was spoken about in great detail. So we have to, as they do in football, you have to look at the game film and see where the mistakes were made, in order that we can correct them so it doesn't happen again. And obviously, we continually find ourselves in our communities having to raise our voice louder and say, you know, what's going on here? Because
Right.
um,
Right.
coincidentally, no matter how you slice it, we seem to always be in the demographic of the area of the people who are highest hit, regardless. And
Coincidentally.
so, and right, and so none of us are conspiracy theorists, but we understand where the conspiracy theories come from, because it's like you have to scratch your head, and it's like, um, here we are again with the
Yeah.
same thing going on.
Yeah. Also, historically, we've had about 400 years of negative media around racism and genetic experiments and attacks on people of color. And so, when you look at the horrendous history, when you think of the Tuskegee Airmen, when you think about syphilis and all these sort of different usage of the Black body, people of color has been
Hmm.
like you said, has been the blunt stick and the blunt instrument of these sort of testing zones in which you can restrict resources, refrain from helping these people, and allow these other people to survive. When we looked at historical systems of housing restriction, you have restricted these people to allow these people to survive. And you can go as far back as Jamestown, right? When they started creating a prison industrial slave complex, you restrict these other people so that these other people, so you're creating a sort of second class structure in which you're separating the people. When we're talking about human life in a pandemic that is impacting everyone, no matter what race you are, that information that you're withholding, you should be accountable for, because it is life-saving information, it's life-saving equipment. It's hard, and it's hard for us in communities of color because we look at the NYPD and police as a gang. That's the way they act. They fit into that description. They are sometimes not the best people to provide resources to the community. I had a grandmother tell me that, when she was assaulted by officers, it's like being beat up like a gang on a corner. And that the only resolution is to go back to that corner and somehow speak to that gang leader and make a complaint. It doesn't work that way, right? That's a social condition. We're talking about life-saving equipment that can help protect, not spread this virus. Why would you not want to concentrate those efforts in the poorest communities, in the hardest hitting communities? We know East Harlem, we know the South Bronx are one of the hardest hitting. You double down and build two centers, one in Central Park and they do another one at Jacob Javits Convention Center, to support the lowest hit district. So I think we're looking at leadership in a way that is neglecting people of color. And this is why community resources have to be on the front line. We've seen Bronx Central Kitchen come in. We're doing over 15,000 meals a day in the Bronx alone. East Harlem, we have all of these different networks. National Action Network has done feedings every day since this pandemic happened, right on 145th Street. And this is community-based resources. This is not supported and the government coming in. This is us as a people creating these survival methods. And I believe that the closing of the schools was necessary, but it also created a system where the youth are now home being the carriers. Right? So if we don't supply them with protective gear and also the families who are stuck in the house now, we're just cross-contaminating and growing that in the neighborhood. I think 100% of certain communities who haven't been tested yet are impacted.
Yes,
Like
and
the
so
Towers,
we have to continue to stay on this. And we've continued to see our complexes, our neighborhoods, with these high rates, and we see sporadic efforts. The city is always and the state are always quick to kind of claim victories, but we always have to kind of look quickly. One of the things that we've been doing on this live stream is that we always start out looking at the data on nyc.gov. When I go in this morning, I find that they've shifted things around, and so the zip code map that we always look at, that seems, I can't seem to find it, but they have put a response map in where they're showing where they're doing PPE distribution. So, I will give them credit that is something that they're doing, but I still want to see the map where we're seeing where the hotspots are so that we can make our own determinations about what's safe in our community. Because while we can look at the general numbers overall in the city that are declining, but we don't have the general numbers. We have specific numbers that are much higher. And as people are trying to make determinations about what the safety is about being outside, we still want to have some awareness of what's going on zip code by zip code. So I'm actually going to bring up the new response map that they're showing just so we can take a look at it and maybe we can glean some information about it. So bear with me a second. Let's see if I can bring this up on our screen.
While you're doing that, can I give out some emails? I mean, some information. Bob? Bob? Did we lose Bob?
All right, and I'm back. So that didn't work. And okay. So as usual, sometimes we have technical difficulties. We only do it to show you that it actually is a live broadcast. I think 5 will be back to join us shortly. I went on vacation, as Carol likes to say. Sometimes we do that in the middle of our calls. So we're not going to share that screen today, but we're going to continue to talk about what's going on. I want to share some information that we got from the Safety Net activists, and they're an organization that is focused on the issues concerning COVID-19 and the homeless, and the fact that the city has not. Hold on, I'm going to bring 5 back in here. Hang on a second. All right,
All right.
so we've each have been able to share in terms of a technical difficulty this morning, and we do things as a team. That's what we do.
Yes, sir.
So 5, while you're gone, I pivoted for a second. I want to mention something about some information we got last night from Safety Net activists, and they're an organization that focuses on issues concerning the homeless
Mm-hmm.
and the lack of response for them. And in particular, they're concerned. In fact, they've started a campaign called #HomelessCan'tStayHome, and trying to address the inequities of resources and the fact that we have all of these empty hotel rooms in the city that could be used to house the homeless instead of just having them wander the streets. You know, one of the things we saw was that the city made a decision to close the subways between 1 and 5, and essentially forcing any homeless people who are on the subways out into the streets. And I found it interesting, the timing of that decision, because basically 2 days before this,
The big
um,
media episode, right?
right, Governor Cuomo had come up with some disparaging remarks about the homeless, and then all of a sudden there was this edict that we were shutting the subways down. And
Right.
so to do this without providing some sort of resources, it just doesn't make any sense, because if the homeless are walking around and they have the ability to spread the virus just like anyone, then how can we be controlling this? And then we have a population where there's literally no opportunity for contact tracing. And so, you know, if we're making all these efforts in every other direction and we have a population who is now forced to be mobile and there's no direction for it, you know, how can we possibly be getting rid of this? So the Safety First activists have identified that there's been a bill introduced, 1927A, which is a bill that has been introduced to reduce the spread of COVID-19 amongst homeless New Yorkers, and including things such as using these hotel rooms. So I want to direct people to a website that has more information on this. The website is 1927saveslives.org. I'll say that again, 1927saveslives.org. And you can go to that website where you'll get much more information about what this bill is about and how to support that with your local city council members to see if we can get that passed. So I think we're going to be wrapping up here. Five, do you have any last things that you might want to share on this live stream?
Yes, so I want to share that there is the New York Campaign for Alternatives to Isolated Confinement. Their email is nycaic.org. What's going to happen in the prison and jails, out of all of the 52 facilities in the 11 state jails and the 79 county jails, is when a person is sick, they're going to transfer them to human isolation with no protection, open ventilation, and it's really just going to be sitting there waiting to die, sad to say. And so we have to defend against this by increasing the treatment, increasing the medical supplies, and also demanding that when people are released, that they also are being tested. And we look at clemency and other items to release the aging and the vulnerable population. If you're 85 and 90, you are zero threat in society. As a matter of fact, we need you in the community back, and we should be preserving lives in this country, not creating conditions to profit off the death of lives. The sad part right now is that there still isn't a functional system to know if your family member is even deceased in prison. There is no way for you to find out outside of calling the individual jails and facilities, and we don't see the governor addressing this population. I think that's the most disrespectful term, to have a talk show and a live stream reality show with your brother, but you not once mention the thousands of people who are held in facilities. And so incarceratednationnetwork.org, nycaic.org, these are all links that can give you further information as to what's happening on the ground with people impacted and incarcerated today.
So Five, I want to thank you for joining us this morning. I want to remind people, if they want more information on what they're doing and want to stay up to date, you can send us an email, Harlem Emergency Network at gmail.com. We're also on Facebook at facebook.com/Harlem Emergency Network. We're also broadcasting live, not only there, but on our Harlem Emergency Network YouTube channel. And we will be back again next Wednesday. We will continue to look at all the issues that may not be addressed in the mainstream media. You can trust and believe that we are looking at every aspect of this, and will continue to do so. I want to thank all of our different community partners for continuing to share information with us. And if you have anything that you think should be on our next broadcast, please send us information at Harlem Emergency Network at gmail.com. Thank you, Carol Johnson. Thank you, Five.
Thank you.
We will be back again next week.
Thank you.
Okay.